Hi, my name is Silje Benum and I'm a PhD student.
And I am Professor and Ophthalmologist Tora Morken.
And I'm Professor and Physiotherapist Kari Evensen.
We are from the Norwegian University of Science and Technology in Trondheim, Norway, and authors of the newly published article in Developmental Medicine and Child Neurology entitled Motor Outcomes and Visual Function in Adults Born with Very Low Birth Weight.
And in this podcast, we will present and discuss our key findings. So, how did we get this idea?
So it's well known that individuals born preterm with very low birth weight have poorer motor outcomes compared with term-born controls of normal birth weight, even when excluding individuals with cerebral palsy. We have recently reported that poorer motor abilities persist into young and mid-adulthood.
And what do we know about vision in preterms?
Yeah, previous studies have reported reduced visual function, including reduced visual acuity. In adolescents, young adults, and adults born with very low birth weight compared with term-born peers. In mid-adulthood, we have found poorer visual function than controls based on both clinical assessments and self-reports.
And we also know that vision plays an essential role in recognition of objects and actions which are crucial for the interaction with the environment, including control of body movements. And we have previously reported an association between motor problems and visual function in adolescents with very low birth weight, where motor problems were most strongly associated with reduced visual acuity. But this association has not been studied in adults before. So in this study, we aim to examine the risk of motor difficulties and whether the outcomes were mediated by visual acuity.
And how did we design the study?
So in a joint study of two Nordic birth cohorts, the Helsinki study of very low birth weight adults from Helsinki in Finland and the NTNU low birth weight in a lifetime perspective study from Trondheim in Norway, a total of 118 participants born with very low birth weight and 147 control participants underwent motor and visual assessments.
Yeah, we assessed overall motor abilities using the Bruning's Motor Ability Test short form, fine motor abilities using the group pegboard and trail making test 5, and gross motor abilities using the revised high-level mobility assessment tool. And cutoffs for motor difficulties were calculated using the 5th centile and 2 standard deviations from the mean of the two control groups.
Best corrected visual acuity was assessed in accordance with the early treatment diabetic retinopathy study protocol at 4 meters under standardized illumination. ETDRS letter scores were recorded and the better eye was used.
So, what did we find in our study?
There was an increased risk of overall fine and gross motor difficulties in the very low birth weight group, where nearly 35% of the participants had overall motor difficulties compared with 5% in the control group, which corresponds to almost 30% risk difference between the groups. For fine motor difficulties, the risk difference were around 11 to 12%, and for gross motor difficulties, about 16%.
Yes, and we found that visual acuity were normal in both groups. However, it did mediate the association between very low birth weight and fine motor difficulties, as well as continuous motor scores for overall fine and gross motor abilities. And when we excluded participants with neurosensory impairments, the results were largely similar.
So, how can we explain this?
Our findings may suggest a causal pathway between visual and motor function. Vision is a primary source of information for motor control, particularly in the early stages of learning new skills. It continuously guides our actions and facilitates interaction with the environment. Consequently, impaired vision may impact both motor development and execution of motor skills.
Yes, and while that is true, the findings may also simply reflect an association between visual acuity and motor difficulties, which could share a common etiology. The optic radiations and the corticospinal motor tracts pass through the periventricular white matter, and injuries and disturbed maturation of these areas in individuals born preterm may be associated with both cerebral visual impairments and motor difficulties.
And what are the implications of these findings?
Motor function is important for daily life, affecting academic performance, work, physical activity, and social life. A greater understanding of the underlying mechanisms of motor difficulties among adults born with very low birth weight may contribute to raise awareness and provide proper intervention and supportive measures for this group. And we would like to give warm thanks to all the participants in the study and to our co-authors. Thank you very much for listening.